The conclusion, by consensus, has robustly been that the benefits outweigh any risks. And on this basis, the Pfizer-BioNTech vaccine was approved for use in children aged 12 to 15. Our work doesn't stop there. The MHRA has continued to scrutinise all suspected side effects data received through our rigorous surveillance programme in place, largely through the yellow card scheme, but with other sources of data used in a proactive way to continue to monitor benefit-risk balance. Of course, we welcome reports of any suspected side effect through our yellow card scheme. So a big message there, please do report. But overall, our advice remains that the benefits of getting vaccinated outweigh the risks for the majority of people, and the vaccine benefit outweighs the risk in children and young people aged 12 to 15. Back to you, JBT.
Have narrowed that is not the case, and can we actually have some numbers there? Because I think people are a bit confused about this change in advice. And
we are, as you can imagine, being cautionary in the way we're approaching this. And that's because we place a very high value on the safety of our children and young people. And I believe we do that rightly, and that reflects the public viewpoint as well, that we should regard the safety of our children and young people very highly.
Ahead of the autumn term, not only to protect those children, to break that chain of transmission in the classroom.
Obviously, children are going to start going back to colleges and sixth forms from September, and in Scotland that will be actually, I think, slightly earlier in some cases. So there is no time to waste in getting on with this. Now we have the JCVI advice on starting that initial first dose in 16 to 17-year-olds, then I want us to proceed as fast as is practically possible. That isn't going to be tomorrow. I don't think it's likely to be early next week, but I can tell you that the NHS has been kept informed of what has been being deliberated by JCVI. It has been preparing for multiple permutations and options for very many weeks now, and I would expect that this programme will start in a very short number of weeks, as opposed to any longer than that.
Is this then not a missed opportunity? If it's a safe vaccine for that cohort, the 12 to 15-year-olds, and you're saying you're seeing some very sick patients admitted.
We've wanted to hear from children and young people themselves as to what they think, and a lot of the feedback we've had is that they would like to have the choice. So they like to be offered the vaccine, understand the risks and potential benefits, and therefore make a choice for themselves whether they want to have it or not. We've certainly heard from groups of people who say they definitely want to have the vaccine.